A very good morning. Today I'll be presenting my case on application of silver diamond fluoride in 2-year-old children. Introduction about silver diamond fluoride. Silver diamond fluoride is a colorless liquid. The pH of silver diamond fluoride is around 10. It contains of 25% silver, which has an antimicrobial action, 8% ammonia, which acts as a solvent, and 5% fluoride, which acts as a remineralization agent. 38% silver diamond fluoride contains of 44,800 parts per million of fluoride and 255 parts per million of silver. These two content, that is fluoride and silver, has a synergistic activity. These are various commercially available silver diamond fluoride. So whenever silver diamond fluoride is been applied onto the tooth surfaces, it leads to the reactions, that is hydroxyapatite crystals reacts to the silver diamond fluoride and leads to the formation of calcium fluoride plus silver phosphate plus ammonium hydroxide. Diamond fluoride is indicated in children suffering from xerostomia and severe early childhood caries. It is also indicated in the children with challenging behavior and also used in the treatment for dentinal hypersensitivity. It is contraindicated in the tooth which required pulp therapy, in the patients who are allergic to silver, and also to the patient who has sensitive open mouth sores. Armamentariums that are required for silver diamond fluoride application. First of all, we take a gauze piece and brushes. Brush to clear the tooth associated and the gauze piece to clean the particular area and dry it. Application of Vaseline, and we need a depend dish to put a drop of silver diamond fluoride into it. We take applicator tip to apply the silver diamond fluoride onto the affected tooth surfaces. Cotton rolls are required to isolate the tooth surfaces, and SDF is required. Steps of SDF application. First of all, we go for oral prophylaxis of the patient, and after that, we go for placing of a petroleum jelly around the tooth structures. If the petroleum jelly has not been applied properly, or if you forget to apply the petroleum jelly onto the surrounding soft tissues, it can lead to a staining of the tissues, also known as henna appearing tattoo. After the application of petroleum jelly, isolation is done using cotton rolls, and after that we put a drop of silver diamond fluoride into our depend dish and agitate it for a homogeneous solution. After that, we take a drop of silver diamond fluoride onto the applicator tip and apply it gently onto the tooth surfaces for 1 minute. After the agitation of 1 minute, we can use air pressure to dry it, and after 3 minutes we can remove the isolation. Biannual application increases the rate of caries lesion arrest as compared to that of annual. 3-month interval silver diamond fluoride on active lesions plus fluoride varnish onto the rest of the dentitions at the interval of 3 months are recommended. There is an evidence of caries arrest according to these studies. So there was a 5 clinical trial of 38% silver diamond fluoride in dental caries arrest in children. So 3 used an annual application which shows an arrest of around 65 to 79%. One application shows 6-month interval and it shows 84.8% arrest, and a single user's application annually shows 31.2% arrest. So it is way clear that the application in every 6 months shows a higher rate of arrest of dental caries. Coming up to my case, a 2-year-old female patient was brought by her mother in the Department of Periodontist and Preventive Dentistry in Indraprastha Dental College and Hospital, Sahibabad, with a chief complaint of decayed tooth. History of presenting illness. Patients come with a chief complaint of decayed teeth since a year and had no complaints of pain, sensitivity, and no difficulty in eating. These are few of the pre-operative pictures of the child presenting dental caries. In extraoral examination, no significant history was found. Intraoral examination, dental caries was present with respect to 5.1, 5.2, 5.4, 6.1 and 6.2, and other surfaces like gingiva, lip, tongue, floor of the mouth, buccal mucosa appearing to be normal. A diagnosis of early childhood caries was made on the basis of clinical presentation. So we'll start with the treatment plan. First, we isolate the tooth surface and dry it properly. After the drying of the tooth surface, we apply Vaseline into the surrounding area to prevent the staining on the gingiva or lip surfaces. Proper Vaseline has been applied, and after that, we take SDF onto the tip and place it gently. The agitation of the SDF is done onto the tooth surface for around 1 minute on each tooth surfaces. After the SDF has been agitated onto the tooth surface, light cure was done. The light cure is used to make sure that SDF sinks deeper into the tooth. The application of dental curing light is done for the increased penetration of silver ions into the deeper dentinal tubules. It also increases the hardness, and perhaps because more silver stays in infected dentine. So light cure was done in my case. So this is the basic difference between preoperative and postoperative pictures in the case. As we can see, the staining of the tooth surface has been done after the application of silver diamond fluoride. Now coming up to discussion, the use of high concentration, that is 38% silver diamond fluoride, has been recommended by American Academy of Pediatric Dentistry due to the higher caries arrest effectiveness. If we talk about the mechanism of action of silver diamond fluoride, then it basically depends upon their two major components, that is silver and fluoride. So first we'll talk about silver. So silver is a positively charged ions, and these are well known for antimicrobial agents. They functions as they disrupt the microbial membrane, they create a membrane permeability, they produce reactive oxygen species, and disrupt microbial DNA replications. Now, as we all know that once the SDF has been applied onto the tooth surface, then what actually happens that if there is again acidification around that area, then the antimicrobial action of the silver that is already present in the dead microbial surfaces will get activated, and it will prevent the caries formation, and this effect is known as zombies effect. Moving up to fluoride. Fluoride is also a potent antimicrobial agent. Fluoride also works with salivary calcium and phosphate for remineralization and hardening the tooth surfaces. In a study, it shows that there is an increased in mineral density, depth of remineralization, and remineralization percentage in STF group was significantly higher. Clinical evidence of effectiveness of silver diamond fluoride. In studies, it has proved that silver diamond fluoride shows caries arrests around 96%, caries prevention around 70%, whereas fluoride varnish shows caries arrest around 21% and prevention around 58%. If we talk about the semi-annual application of silver diamond fluoride, it shows that overall around in 30-month interval, it shows 75% caries arrests. In lower anterior teeth, 91% caries arrest. Upper anterior teeth, 85% caries arrest. Lower posterior teeth, 62% caries arrest. And upper posterior teeth, 57% caries arrests. And if we talk about the clinical trials, it shows around in 30 months it shows 67% if we apply once in a year, and it shows 76% if we apply twice in a year, and maximum it shows in maxillary anteriors, and whereas minimum showed in maxillary posteriors. Systemic reviews and meta-analysis that evaluates the effectiveness of silver diamond fluoride use in primary teeth. It shows that the silver diamond fluoride is more effective than fluoride varnish. Silver diamond fluoride application slows down the active caries in primary teeth. 38% silver diamond fluoride arresting dental caries. Silver diamond fluoride has a potential to arrest caries in permanent first molar and primary teeth. If we talk about the acceptance rate, then according to article, it has been concluded that the SDF applications is better accepted in the posterior as compared to that of anterior teeth, and in deciduous as compared to that of in permanent teeth. It is a trend towards the higher income or middle income, and with the higher education levels are less likely to accept the use of SDF and staining process. Coming up to the conclusion, the use of silver diamond fluoride fulfills the World Health Organization developmental goal of health and can contribute to reduce the inequalities of oral health around the globe, as well as provide a friendly treatment approach in pediatric dentists in dental clinics. According to the American Academy of Pediatric Dentistry, the panel made a conditional recommendation regarding the use of 38% silver diamond fluoride for the arrest of cavitated caries lesion in primary teeth as a part of comprehensive caries management program. In today's scenario, available scientific data on silver diamond fluoride no doubt provides a best possible way to arrest and prevent dental caries. Needless to emphasize that in present situation, the COVID-19 pandemic situations, where the generation of aerosol is a big hazard, silver diamond fluoride can be a game changer. So, the silver diamond fluoride amputee deserves to be termed as magic bullet in the management of dental caries. These are my references. Thank you so much.